First up today, last year, Catholic health employees went on strike for a month until they got a better contract. And though Kaleida healthcare workers have voted to strike, negotiations are on hold between them and the union for the week. And this comes as Western New York's largest hospital, ECMC, is also beginning contract negotiations. Danielle Church is on this one for us today. So Danielle, any possibility that they could end up going on strike as well?
So Kate, they actually cannot go on a strike at all. I'm told that's because ECMC is a public hospital and acts as a safety net whenever something happens at another one of our region's hospitals. Now, that doesn't mean the New York State Nurses Association can't help them fight for a better contract, though, and they fully intend to, showing up outside ECMC this afternoon to voice how upset they've been with low staff, supplies, and wages, in addition to unsafe working conditions. There are 1,300 nurses at ECMC. This is the first time they will begin contract negotiations since before the pandemic began. It's also just one of 80 contracts NISNA will negotiate across the state this year.
Many of my professionals have left the profession entirely or have moved to somewhere else. We have very few senior nurses on my shift in the medical ICU because of the lack of preparedness that they were forced to have, as well as the lack of N95s that they were supplied. We had a lack of resources and we were asked to do several jobs and additional duties with a lack of staff compared to what we normally would have.
Plenty of nursing schools with wait times, plenty of nursing schools with a waiting list. Not so many facilities with good working conditions, though. It's not a nursing shortage, it's a shortage in the facilities to provide the safety and competitive wage and the things that we deserve to do patient care properly.
So ECMC officials sent me this statement saying they look forward to productive conversations with NISNA, and they are hopeful union partners will help them get the resources needed from government and private payers. ECMC officials also agreed staffing has been an issue. It's why they agreed to a mid-contract with NISNA to raise wages by 7.75%. It's helped them recruit more than 280 nurses so far. Senator Kirsten Gillibrand is trying to push for $1 billion for healthcare workers to help close some of those gaps within hospitals as well. They would be able to use the money where they need it. Kate?
All right, Danielle, thank you for the update.